Every life is invaluable and precious. The problem of sudden cardiac death is a major concern all across the world, affecting people of different age groups. When it comes to India, the problem has escalated because of sudden lifestyle changes and food choices as well. When medical emergencies like cardiac arrest happen, it's very important to be prepared. If you're aware and informed and know what steps to take, you could actually revive a person and save a life. Now, worldwide, millions of people are dying of sudden cardiac arrest every year. And this is partly because of limited and sometimes ineffective bystander cardiopulmonary resuscitation or CPR. Many adults can be revived with intact neurological functions if bystanders can provide immediate CPR, which is why raising public awareness and understanding of the practical applications of CPR is just so essential. As always, we're being joined on Save a Life by medical experts who will be telling us exactly what to do in order to give CPR. Eminent cardiologists who will help us understand the concept of sudden cardiac death and the role of CPR to revive and save a life. We're being joined by Pavan S. Agarwal, consultant interventional cardiologist with Radiant Super Speciality Hospital, Amravati, Dr. Rajdatt Ashok Deore, adult and pediatric interventional cardiologist, Pulse Cardiac and Diabetes Center, Pune, Dr. Professor Ramamurthy Bingi, senior consultant interventional cardiologist with Bingi's Heart Care and Fertility Center, Bengaluru. Thank you all for being with us. Dr. Agarwal, let me begin by asking you, cardiovascular diseases are clearly the leading cause of death globally, but can heart disease be cured or reversed?
As you have aptly said, cardiovascular disease and heart disease are rising exponentially in last 2 decades. And the worrisome fact is, it is affecting younger generation of the family, who are the sole bread earner of the family, and behind that, whole family is getting affected.
Yes.
So yes, cardiovascular disease cannot be cured or reversed, but that doesn't mean that the progress of the disease cannot be halted or slowed down. If you follow certain things in your life, like dietary precautions, you reduce intake of your carbohydrate, fat in your diet, take more protein, green vegetables, and reduce the calorie content. Second is risk factor control. If you are diabetes, blood pressure, cholesterol, you take proper precaution of these, regular follow-up, regular medicines, and control this disease. Third is daily exercise. 45 minutes a day in any form of exercise, 6 days a week will keep you fit. And the foremost important thing, which is rising in India in very high proportion, is consumption of tobacco. So you avoid tobacco in any form. And when we will follow all these 4 things, we can definitely halt the progress of cardiovascular disease in India.
Right. Dr. Deore, is it possible to prevent cardiovascular disease? What is meant by primary prevention and secondary prevention of heart disease?
Yeah. Ma'am, cardiovascular diseases are largely preventable by lifestyle modification or healthy lifestyle. So prevention is very important part of cardiovascular disease management. There are multiple risk factors which predispose a person to cardiovascular diseases like obesity, hypertension, diabetes, dyslipidemia. So treating this risk factor before onset of cardiovascular diseases is called primary prevention. So early detection of risk factors, early initiation of treatment for these risk factors, regular treatment under medical supervision is very essential part of primary prevention. Secondary prevention focuses on early detection of cardiovascular diseases by specific screening test in a certain population or certain vulnerable groups. So early detection and then aggressive treatment of cardiovascular disease in initial stage of disease will reduce that impact by preventing critical and permanent organ damage in the form of heart attack, paralysis, kidney failure, blindness. I will go one step forward in recommending primordial prevention, that is healthy lifestyle, that is healthy diet, regular exercise in children and young adults, so that these risk factors will be avoided or delayed, and thus delaying the onset of cardiovascular disease.
Dr. Bingi, are men at higher risk for heart disease than women, and do men and women experience the same symptoms when it comes to heart disease?
It is a fact that we were telling that women are protected up to the age of 45 years. But now we have recognized, because of the changing lifestyle patterns and onset of the metabolic syndromes, early diabetes, and physical inactivity, and stress levels being high even in young women, even below the age of 45, we have started seeing a large number of coronary artery diseases. There is no much of a difference as far as the commonness of the disease is concerned. The more or less the same, but the symptoms wise often true that women do have some atypical manifestation. They need not have a typical chest pain in the retrosternal area, the left arm radiation. They may have only a shoulder pain, or they may have something like vomiting or some sort of a breathlessness or palpitation. So these atypical manifestations are quite frequent. It is equally true also, the so-called silent heart attacks are also common among women, apart from the elderly and hypertensive population.
Right. Dr. Agarwal, if I can bring you in at this point, what is meant by myocardial infarctions, and are they fatal?
Yes, myocardial infarction or heart attack, what we commonly call, is a condition of worse prognosis and extreme seriousness. Heart attack occurs is a late sequelae of the atherosclerosis or fat deposition, where as the gradually fat deposition worsens, one fine day, the heart blood vessels will get 100% blocked, so that the area to which it is supplying the blood to the heart muscles will get affected. That area will not get blood supply, and there the process of irreversible damage to the heart muscle will start. And this damage will cause complications of heart attack. The early and the serious complication is there can be cardiorespiratory arrest, and which can result into immediate death. So that emergency protocol, emergency treatment has to be started. And once patient survive this, there can be late complication, because due to heart attack, your heart muscles will get weakened, your pumping will be reduced, heart pumping, and you have to live with the chronic heart failure. So the most important, these heart attacks are very fatal. If you suspect someone having chest pain or heart attack, he should immediately go to the nearest hospital where advanced ICU care, cath lab, and primary angioplasty procedure is available. Because primary angioplasty is the only procedure which can save maximum of lives in a heart attack patient.
Right. Dr. Deore, in our discussion on heart attacks, we're mentioning how they're caused by clogged blood vessels. Now, what level of blockage actually requires a stent?
So basically, heart is a bag of muscle which pumps and circulates blood from head to toe. For this to work efficiently, it requires blood supply of its own, which is called coronary arteries. Whenever there is blockage in coronary arteries by blood clot or cholesterol, that leads to weakening of this heart pump and thereby decreases the circulation. So whenever there is blockage of more than 90%, that leads to heart attack, leading to irreversible damage to heart muscles. But even blockage more than 60 to 70% leads to shortness of breath or exertional breathlessness. So and these are the warning symptoms of heart attack. So if we could catch these symptoms, recognize these symptoms early, we can prevent major heart attack. So any blockage more than 60 to 70% requires implantation or placement of stent inside the blocked blood vessel. These 60 to 70% blockage can be detected early by screening tests like treadmill test or heart scan, and thereby we can prevent major heart attack, major deadly heart attacks.
Right. Let me take this across to Dr. Bingi now. Dr. Bingi, many people are wondering if they're also making a mistake with their exercise routines. There have been so many instances of celebrities who've suffered heart attacks in the gym or, after a sudden workout. What causes sudden death during and after exercise, and just how careful do we have to be, and what are the signs to watch out for?
So a very good, interesting point. We have been listening because of the media that there are a large number of celebrities dying. We know that the commonest is still in 75 to 80% of the people. It is the heart disease alone. And we have seen two age groups below the age of 30-35. Often we see some rare diseases like hypertrophic cardiomyopathy and the like, and some arrhythmic disorders. But above the age of 35, still the ischemic heart disease is the common. In fact, 25% of the patients almost come to the heart ICUs with an possibly first manifestation of a heart attack. And in this process, of course, we have recognized that the majority of them, they do have recognized or unrecognized heart disease underlying, and thus they should reach to the doctor and get evaluated whether they have risk factors or no risk factors, whether symptoms or no symptoms. And we have also recognized those who die in the gyms often have done a very vigorous exercise to start with. There's something like a binge exercise, without any constraint they have done exercises, and that is how they do collapse. And here, because of the plaques ruptures and arrhythmias happening and the sudden death happening. Hence, they should reach to the doctors, get them evaluated. Particularly, I'm talking to the middle-aged population. They suddenly think of going to do the exercise. It should be done in a much gradual manner, and exercises should be chosen depending upon their age factor and other factors concerned.
Right. We will take a very quick break at this point, but be back in just a moment on Health and Wellness Save a Life to answer all your questions. Keep watching. Welcome back to Health and Wellness Save a Life. Let's take this right back to Dr. Agarwal now. Dr. Agarwal, does CPR apply in both conditions like cardiac arrests and heart attacks?
Yeah. First, to understand the CPR, we should understand the difference between the cardiac arrest and heart attack. Cardiac arrest is a condition where heart has stopped the beating, and if within next 1 to 2 months proper measures are not taken, it can result into the death. As we are all aware, heart is the most vital organs. Our life is there till our heart works. And cardiac arrest is the end game for all other medical emergencies which can result into the death. So before death, cardiac arrest will occur, heart will stop, and the death will occur. Now regarding heart attack, as we have seen, it's a myocardial infarction, and heart attack can result into cardiac arrest. It is one of the important cause of the cardiac arrest, but not all. All other medical emergencies also can give rise to cardiac arrest. And the most important thing at this juncture is to start the cardiopulmonary resuscitation.
Right.
You have to start the heart within next 1 to 2 months, 1 to 2 minutes, so that patient can regain his life. And for that, all we should aware the CPR procedure. If you have seen someone is collapsing or he is having cardiac arrest, you should call for extra help, or the person who has some experience in cardiopulmonary resuscitation. This person will require urgent medical attention because he may require defibrillation and other extra procedures. And if patient survives this cardiac arrest, then the reasons which has led to this cardiac arrest has to be studied. And at this juncture, I will definitely like to tell that CPR is the most important thing, and I think it has to be bring into our practice, like community or in the school, where as a education we should teach everyone the CPR procedure because it's a life-saving procedure.
Right. Dr. Deore, how would a bystander, a non-medical person, know whether he or she is doing CPR with the correct technique? Can you run us through those steps? And is it possible just to sort of know about it without actually practically ever having taken a course, or can you just learn about it by reading about it or by watching demonstrations?
Yeah. So basically CPR is cardiopulmonary resuscitation. It is to resume pumping action of heart so as to restore circulation of blood to vital organs. So whenever a person collapses or becomes unresponsive, then bystander should come into action. And first step is to tap on the shoulder of the person and ask him if he is okay. If there is no response or there is no breathing, then bystander should start CPR. By that time, bystander should seek for medical help if someone else is standing by. While CPR, first we have to place one hand, that is heel of the hand, on the central chest of the person. Then also place the second hand on the first hand and interlace the finger, okay, and place both the arms on the central chest. Then keep arms straight and position yourself above the patient's chest. Then push hard and fast so as to compress the chest by at least 2 inches, and compression rate should be 100 per minute. For after every compression, we should allow chest to recoil in between the compression, and after each 30 compression, there should be 2 breaths to be given by mouth to mouth respiration. So we have to repeat this cycle of 30 compressions followed by 2 breaths till patient becomes responsive or medical help is available. So that is the correct technique of CPR.
Right. Dr. Bingi, what precautions should existing heart patients take, especially when they're traveling?
It's a very interesting point. Actually, many of us do travel. That doesn't mean that because you have a heart attack or a heart failure, you should sit at home. You can enjoy the life. While traveling, you should carry all the medicines that have been prescribed earlier by the doctors. And here we try to divide into 2 categories. Those who had a recent heart attack, a recent stenting, recent heart failure, it is preferable they should listen to the doctor and then only they should do the traveling. But those who are having chronic diseases, they have to take the prescription, whatever the manner it has been given, including some emergency drugs like aspirin and some amount of antacids also, and the role of statins and ACE inhibitors as an emergency drugs is a little conjectural. Of course, we should try to avoid sports, where in the hot environment, going to Himalayas and trying to do the skiing. And you should try to avoid driving by yourself for a long distance, more than 6 hours or 8 hours a journey. And before you do such sort of activities, preferably see your own local doctor and find a solution, whether you're really fit to travel with, and also the activities that you can do. And you can carry the medicines, all of them, with the prescription sheet that we have given, and you should try to keep them as close to the possible. Don't put it in a bag which is thrown into the bin, into the preferably you should head bin, keep the bags, that sort of a bags you can carry. And you should be, of course, with the international travel, they do ask for the prescription that you should always carry.
Right. Dr. Agarwal, what is the link between cholesterol and heart disease? If the body makes its own cholesterol, then, why are we always being asked to watch our diet?
Right. That means last 5-10 years, everyone is speaking about cholesterol. As you had aptly said, 70 to 80% cholesterol is prepared by our own body in the liver, and that cholesterol is just not a wastage. It's an essential raw material for formation of the cell membranes, for formation of certain hormones, for formation of the vitamin D3. So yes, our liver makes cholesterol, and that is useful for our body formation. But 20 to 30% cholesterol is consumed in the form of by the dietary intake. And whatever cholesterol we consume, usually most of them it is converted into the triglycerides or LDL, low density lipid, which is a bad cholesterol. And all these excess fat or excess cholesterol will get circulated in the circulation, and then it will get deposited in the different blood vessels. It may, if it get deposited into heart blood vessels over the period, it will cause heart blockages and heart attack. If get deposited in the blood vessels of the brain, then it will lead to stroke or paralysis. It can cause blockages of your peripheral blood vessels, so can give rise to claudication or peripheral vascular disease. So we have to restrict our dietary cholesterol. You have to keep it regular measured. The bad cholesterol is LDL and HDL is a good cholesterol, which will clear the circulation of the bad cholesterol.
Right. High blood cholesterol is also an important risk factor for blood disease. If a person's cholesterol is less than 200 milligrams per DL, should that person be worrying about heart disease? Dr. Deore, if you want to take that question.
Yeah. So unlike infectious diseases which are caused by a single agent like bacteria and virus, non-infectious diseases or communicable diseases, or also called as lifestyle diseases like heart attack, paralysis, these are not caused by a single agent. These are caused by multiple risk factors. So cholesterol is one of the risk factor. It is not the only risk factor which causes cardiovascular diseases. So there are other risk factors like diabetes, hypertension, smoking, obesity, sedentary lifestyle, strong family history of heart attack or paralysis. So these all modify risk of cardiovascular disease in a person. So cholesterol is an important factor, but is not the only risk factor which will lead to cardiovascular disease or heart attack. So even with normal cholesterol, in presence of other risk factor, patient might get heart attack in future.
Right. All right. Thank you all very much indeed for joining us on this edition of Health and Wellness Save a Life. Your tips have been truly interesting and informative. Thanks for watching.